Good morning. I'm Spring Schmidt, the Deputy Director of the St. Louis County Department of Public Health. I am here to talk to you today about some of the concerning trends that we've been seeing in COVID-19. This disease that we are currently facing now with the Delta variant is different. It is more transmissible among the population, and it's more likely to affect children. And we're going to talk today, and you're going to see some additional data points that gives us some of the reasons that we have this particular level of concern. There is a combination in St. Louis County of relatively low vaccination rates and high levels of community transmission that make breakthrough cases also an increasing reality that we're seeing in the public. I understand that much of the public is frustrated. We understand and feel that too. We would all like to return to our pre-pandemic normal life, and this is our undeniable reality for the place that we're in right now. I also understand that you may receive conflicting information related to what I'm sharing, and that it sounds like this information is changing every day. Often, that's because it is. This is an evolving situation. We are trying to present the data and information that we know about it as fast as possible out to the community so that you can use it to make decisions and understand the decisions that are made by others. We are committed to that level of data transparency and will continue to do so over the course of this pandemic. Throughout this presentation, I hope to shed some further light on some of these trends, share what we're doing, and offer some recommendations for how we can all be safer as we are conducting our activities throughout St. Louis County. At the end of the day, we are all in this together, and if we don't work together to overcome this pandemic, this virus will further prevent our ability to get back to normal. So the next slide is going to talk a little bit about what we're seeing when we talk about the overall level of community transmission that we have. We talk about this number of cases that we have every day. I will tell you that we put this slide together late last night to make sure that we had the most recent updates. And I was just informed this morning by our staff that we are now over averaging 300 cases per day as of this morning, based on our information that was updated since last night. So this is a constantly evolving situation. That number of new cases that we're seeing every day results in some additional numbers showing why St. Louis County is marked on the CDC's map of high levels of community transmission. The CDC uses a number that is the cumulative total of our last 7 days of transmission divided by 100,000 residents. That number for St. Louis County is 170 because we've had over 1,700 cases in the last 7 days. That puts us very firmly in that red territory, which is why the CDC has recommended that we use as many mitigation practices as possible. The CDC uses this number to associate their recommendations for schools, for communities, for mask wearing, for contact tracing and quarantine, and all of the other characteristics that they say are the thresholds that we need to use safer behaviors as much as possible. We also are showing our testing positivity rate. This is a rate that we've been talking about in this pandemic for the entire time. This testing positivity rate of 11.8% does mean that for all of the people that are currently getting tested in the community, over 11% of them are coming out as positive. We generally take this to mean that not enough people are currently getting tested in our community and that there are a lot more people in St. Louis County who are COVID positive who have not yet been tested. If we have a lot of testing out there, it means generally drives that number now down because we either are capturing everyone who's currently positive or we're not. And that's what that number means to us. We know that the Delta variant is present in our community. A rise in genomic sequencing confirms that this variant is present, both in sequencing of active tests that have been collected by the population, as well as the testing that is done by the state of Missouri in our sewer shed, showing the presence of variants throughout the county. Compared with prior strains, the Delta variant is more transmissible for everyone, both indoors and outdoors, and for all ages. The relaxation of mitigation practices such as masking and social distancing compound our already increased level of community transmission. What does this really mean for you? It means that you are very likely to be exposed to someone with COVID-19 in your everyday life. That means at your grocery store, in your workplace, in your home, in schools, and everywhere else that we operate. Safe and healthy mitigation practices reduce your risk, and that's why we focus on those things. On the next slide, I'm going to talk about why we see some of this disease as being fundamentally different than last year. One of the things that we've been seeing is the rising cases in children. We have talked about this several times recently, and you've heard some additional information from the Pandemic Task Force about this as well. We are seeing this increase, and about 1 in 5 cases of our current total cases are coming from children under the age of 19. You'll also see that we have been increasing in the number of cases for children under 12. Last year, when we were concerned about the pandemic, we began to see evidence as we were approaching the school year that some of the current alpha variant that was present in 2020 was not transmitting as effectively among children, and that was fantastic for what we were seeing in order for those kids to participate in school and several other activities. However, that is not the case with the current Delta variant. It is as transmissible in children as it seems to be in adults. And so we are seeing children be affected by COVID more frequently. It is true that they do not often experience as many of the severe negative outcomes, such as hospitalization or mortality. However, that does not mean that we do not currently have children who are experiencing those severe outcomes. So it is possible for children to spread COVID and have COVID at the same level that adults do, and there can be more severe consequences, which is why we think children require the additional protection of our entire community in order to make sure that they do not experience that. So if you are a parent of a child over 12, please talk to your pediatrician about the opportunities for vaccination. Talk to them about your questions that you may have around mitigation practices, and get your children over 12 vaccinated, please. If your child is under 12, you can use these mitigation practices such as masking, social distancing, hand washing. All of that is still very valid ways to protect our children in all of the activities that they engage in and make sure that they can do them safely. On the next slide, what you'll see here is we have talked before about breakthrough cases. And we do not mean for any of this data to be presented as an opportunity to instill fear, but it should instill caution, and that is the message that we have. We have seen a rise in cases among vaccinated individuals. You can see by this graph, though, that that rise is actually significantly lower than the rise in cases that we're seeing among the unvaccinated. We also have noted that those vaccinated individuals that do catch COVID tend to have significantly fewer complicated outcomes such as hospitalization or death. They tend to have a much milder form of the COVID illness. They can induce spread disease and COVID when they are out and about, which is why we have focused on recommending masking for the vaccinated as well, and the CDC has been very clear on that guidance as well. So really, what does this mean for you also? It isn't just enough to be vaccinated in the current level of community transmission. You need to get your loved ones vaccinated to care to minimize your exposures to people by masking and making sure that you are not spending a lot of time in locations with vaccinations where the vaccination status is unclear of several other people. Given the increasing number of cases in children and that they are also participating in our public spaces, it means that well-intentioned vaccinated but unmasked people can and will infect others if they are not careful through their mitigation practices. This is our reality. We understand how disheartening this is, and I too am frustrated, and many of our health department staff are as well, but this is our best opportunities to make sure that our spaces that we're all engaging in the public stay as safe as possible. On the next slide, we're really going to start to talk about the vaccination rates that we're seeing in the general population. I know that many people have seen this information before. Our high rate of community transmission is fueled by the fact that we are just a little over 45% vaccinated, fully vaccinated in St. Louis County. The high rate of community transmission and that low rate of vaccination makes for a very concerning combination. This means that COVID-19 will be with us for a longer period of time. Delta is not the only variant that's currently present in the United States, and the longer that we go with rampant transmission, the more the virus will mutate, probably to our detriment. Almost all of those that are currently hospitalized for COVID-19 are those that are unvaccinated. The Pandemic Task Force has reported an increase in hospitalizations several days, several weeks now in a row, and this is concerning given what we have been seeing across Missouri and in other parts of the country as well. It really means that the longer that we go without you or your loved ones who have the opportunity to vaccinate, the longer it will take us all to get back to normal. And this is not meant to sort of be fear or to instill anger. This is meant to present the reality that we are currently in. On the next slide, you'll start to see some of this information disaggregated. One of the first things that concerns us is this change in rates by age. So as you can see, many of our senior residents in our community have really taken to the vaccination efforts. We think this is excellent. We do have some seniors we would like to still continue to reach with opportunities for vaccination, but you can see that many of our population over 65 are 60 or 70% vaccinated, fully vaccinated. And that's excellent because that is a population that we want to see as much protection as possible. We'd still like that number to increase so that the entire population is as protected as they can be, but we are encouraged to see that. However, less than half of those under the age of 50 have gotten a shot. And you can see from this data that those opportunities are decreasing every 10 years of age that we go down. So the younger the people are across our entire community, the less likely they are to be vaccinated. We know that our children under 12 are not currently eligible for that, which means that we need to make sure that we're continuing to protect that. But it also means that those 12 to 19, the 20 to 29-year-olds, 30 to 39, and 40 to 49 are still much lower vaccinated regardless of where they live or any other demographic across the county. And that's something that is concerning us quite a lot. On the next slide, you will also see that we have been talking about our zip code data. You'll see geographic differences across St. Louis County. There are significant disparities in our vaccination rates by zip code. The zip code areas in lighter blue have the lowest vaccination rates currently by population. Many zip codes have above 70% of the population, but that still means that about a third of the people that you encounter are not vaccinated in each of these zip codes as well. You'll also see that some of those zip codes around North County are areas that we have been focusing on with many of our community outreach efforts for a long time now. The 6 zip codes with the lowest rates are currently outlined and have been the primary focus of DPH for several months now. We are well aware that in St. Louis, zip code and race are heavily correlated. This also correlates with disparities that we have seen in race in vaccination percentages. 43.9% and 43.3% of Asian and white Caucasian residents are fully vaccinated, compared with only 23.9% of our Black and African American residents at this time. This is particularly striking, again, by age among children, where our African American children residents are 3 times less likely to have initiated the vaccination process. This data that is up here is first dose data, so we do expect many of those people to complete doses, and it is continuing to change as we move forward. This is not meant to, again, stoke fear or anger about the decision or hesitancy that some of our residents may have. This is our opportunity to continue to reach out with information and evidence and opportunities to engage with medical professionals about what we know about this vaccine and why we recommend it in our community. You can see from the next slide that we've seen the pace of vaccination increase over time. This is also stratified by age, so you can certainly see when the vaccine was more available and focused on our older adult population, that was when those vaccines began to rise and then began to level off. You can see one big spike when the vaccine became available for our 12 to 19-year-old population, that we did see that, but you can also see how fast that fell off. So you can see at the very end, we are seeing a slight uptick in July in terms of the doses being administered. This has increased from last month. We were delivering in St. Louis County among all vaccinators about 1,100 vaccinations a day. We're up to about 1,767 vaccinations per day as of July 27th, but we still need that to increase if we're going to make significant inroads into the unvaccinated population. So the most significant jump over the last month is also in our teenage population. As of July 29th, 38.7% of those in this age group have received at least 1 dose of a COVID vaccine, compared to 32% that we were at about a month ago. So we are seeing that group increase slightly more. These are fairly modest increases, though, in what we are capable of delivering, both from St. Louis County as well as every other vaccinator that is available, with a lot of additional appointments and opportunities for vaccine. The Inner North region is also still initiating vaccination faster than any of the other regions, and we'll continue to talk about that in a minute. So really what I want to understand for this is that while there have been gains, the pace overall is still fairly slow. At this pace of about 1.7 first doses for every 1,000 people per day, we won't reach over 50%, particularly in some of our North County zip codes, until late October. On the next slide, you can also see where we have been focusing on working on those particular zip codes. We believe in community outreach. We have been focusing many of our neighborhood clinics. This is neighborhood clinics that are in addition to the regular sites that we operate in the health department or with our partners on a daily basis. So we have currently done over 87 events at 55 different locations, clustered predominantly in our North County area. We have delivered as few as 2 or as many as 271 doses. We are available and out there meeting the community where they are in order to provide doses and have conversations with people about questions that they may still have or any hesitancy that they are engaged in. This has resulted, as you can see on the next slide, in some additional gains. So as I said, our inner North County area in St. Louis County has actually been initiating vaccine a little bit faster than the rest of the county. And so we are still encouraged by the residents that are willing to engage at this point with providers. These aren't just from DPH in this slide. This is from all other community providers that are vaccinating in that space. But we've been heavily focused on that with our particular efforts for a while. We believe we are reaching out to communities. We believe we are trying to have as many open conversations as possible, but we are still pushing forward with opportunities to make that even more accessible and even more available to our population. We still are at not a pretty modest pace. We would like to see an increase in order to help stop COVID-19 in St. Louis County. So it is possible to continue moving. All of our efforts are not in vain, but we do have a lot of ground to make up as we continue to have open conversations with residents about what we're capable of doing. Finally, we're the health department. It's very important that we talk about what we can do. I've mentioned it a few times in this, but the things that we can do to control what we are facing right now in terms of this rising pandemic and how it's going to affect our entire population is to get vaccinated, get tested, and please wear a mask and social distance in as many places as possible in public. As I said at the start of this presentation, this is not the place that anybody is comfortable or happy being. We don't want to be having this conversation, and I understand the frustration that people have, but our reality has changed as the virus has changed. We need your help in fighting this new version of COVID-19 and how it is affecting our community. Please help everyone that you know get vaccinated. If you want to reach out and talk in opportunities, we have transportation opportunities, we have mobile opportunities. We will work with you in any way possible to assist in vaccination. We are also happy to talk to you about whatever your concerns are for the science or for your medical conditions or any other questions that you may have. If you have any symptoms or exposed to anyone with COVID-19, please go get tested. We need more people in the community to test because we know there's more virus out there than we are currently finding in testing. It is no longer enough just to be vaccinated in the community. The CDC has been very clear about this. We have tried to be very clear about this. Please wear a mask in public spaces to protect yourself and others. Please think critically about the social activities that you engage in and work to keep our public spaces as safe as possible as we move forward. Thank you all very much for this opportunity.